So here we go. It's Dr. O and Mindy, and we are going to have a conversation in the presence of at least one person here who can actually ask questions in the chat. And other people may join us, and we may have all of this flow into a nice stay awake and aware. We're going to have a series of small little snippets that help you understand your body better and understand that you can't just hand it over to the conventional medical system. So, I am, as I said, Opeyemi Parham, a retired family practice doctor, a woman in tune with conscious healing in the sense of a whole community of women that I will reference elsewhere who are getting together to look at how we look intuitively at our health. And that word that is the acronym witch. I am a Black witch doctor here to try to help us people who have wombs understand that the system is not terribly knowledgeable or helpful to us. And if we're not careful, it can be harmful to us. We're going to be discussing a particular way it has been challenged. And that's where my friend, whose head is below me as we do this, Mindy, comes in. So you introduce yourself and welcome.
Thank you so much, Opeyemi. Thanks for having me. I'm Mindy Blank. I use she, her pronouns. I'm a community organizer and an herbalist, and I'm somebody who has had endometriosis for a long time. And I'm really interested in endometriosis education and sharing my story both as a way of healing and continuing the healing process and as a form of education also, and as a form of community care. So,
It's the
so I was,
community care that I would love to start with. Because when I went to my local senior center, where the average age is 65 or so, and a bunch of minimally melanated, that is from European descent, lovely women were sitting, and I was informing them that I would be doing this. Their first question was, what is endometriosis? So I want to say to whoever's watching, and I hope we have an age range from 18 to 80, that women in my age bracket and older, we did not have a word for this. Whether we had this as much as we have now is questionable. Where has this been historically? Who knows? Why is it a mystery? Because the bottom line is the medical track that we follow, meaning allopathic medicine, has been very patriarchal and therefore not very awake, aware, or caring of women's reproductive health. Our pelvic issues have been minimized. And this is where my friend's experience will come in. I just invite you to tell a little story about just first of all, we're understanding endometriosis is a term for a phenomenon where tissue that is identified as tissue that should be a part of what sheds from the lining of your uterus isn't shedding from the lining of your uterus. It's showing up in all these bizarre and unusual places, everywhere from just outside of the tubes or on the tubes to in the intestines to outside of the gut to in your lungs. What the? So this is where it gets really, really bizarre that we have illness, and I put this in snare quotes because we don't even know what this is. We don't know if this is one thing or five things that all act kind of similar, but they have been minimized because the symptoms have not been looked at. So, first of all, to make the diagnosis, on the average, according to the information on the internet, takes our medical system 6 to 8 years. With that, I hand it over to my friend on how did you go about getting a diagnosis, and then we'll stop and pause again.
okay. Yeah, that sounds good. Yeah, I'll share a few minutes of kind of the general timeline of my story living with endometriosis, and then we can maybe zero into a few different places. So I started bleeding when I was 9, which was the onset of the pain of this disease. And I call endometriosis a disease. You can call it different things, and I'll refer to it as a disease. So at that time, I was told, "Welcome to womanhood. Being a woman means suffering. It's normal to have pain and cramps like this. This is how it is for everyone." Um, so for 5 years of my childhood, I was in debilitating pain while bleeding, missing school, overusing ibuprofen, developing stomach ulcers, and a hiatal hernia, along with my endometriosis. And the first time that I heard the word endometriosis, I was 14. My family doctor told me that I very likely have endometriosis based on my symptoms, but the only way to know is through surgery. I didn't see any specialist at the time. It was only my family practitioner, and he put me on hormonal birth control pills to treat endometriosis. I asked my doctor at that time if going on birth control so young and for a long period of time might impact my fertility down the road, and he said, "Absolutely not. It's totally safe." I had my doubts even at 14. um, so in my teens and my early 20s, I took hormonal birth control. And while the pain with bleeding and ovulation was reduced, other symptoms increased. And the birth control served only to mask the progression of this disease.
So I want to pause you there because that's just a lot. And I want our listeners or whoever listens to just really take a moment to be with your own body as you listen to a story about pelvic pain that from the beginning was abnormal. So I want to pause you to respond as a family doctor. A 9-year-old getting their period in the first place is to be questioned. First, you want to know how old the parent, the female parent, of that child was when they got their menstrual period. Can you respond on your mother's behalf? How old was she when she first bled?
I'm not sure. I'm not sure when my mom bled.
The ways we don't talk about the things that are I'm going to say the preventative things, we go really, really back to the beginning. There was something abnormal that was not likely abnormal that was not noted from the very beginning with a 9-year-old bleeding. In my story, where my own flesh and blood was showing signs of puberty too early, I was bleeding at 13. She was having breast buds at 9, which meant 11 for bleeding, which meant something's off here. I immediately thought too much estrogen exposure. Too much estrogen exposure coming in from outside of her body. God alone knows where it's coming from right now. It could be the meat she's eating, the air she's breathing, the water she's drinking, but I can control the meat she's eating. So I took her and put her on organics as much as I could. And the breast buds were the only sign, and she bled at age 13. So I kind of helped back off in my narrative as an anecdote. This isn't saying, go do these things. This is what happened in my story. So you were bleeding way wicked young, number one. Number two, the treatment for the problem was more estrogen in your body, but with very careful control, cyclical control that comes from a pack of pills and tells your body when to bleed. So continue on with how you lived with your endometriosis diagnosis and your treatment plan of birth control pills.
Yeah. Well, in my mid 20s, I went off of birth control. And at that point, I didn't bleed for a year and a half after going off of hormonal birth control. And during that time, I went to doctors and I started seeing specialists, and I was completely dismissed. They couldn't tell what the problem was and had no interest in trying to help me. So when I began bleeding again, it brought completely unmanageable pain and inflammation cycles. And after 2 years of that and feeling very unresourced in that and trying to manage that, I finally met with a surgeon who specializes in endometriosis at UVM Medical Center, and she set me up for an exploratory surgery. And they found stage 4 deep infiltrating endometriosis and suspected that it had traveled from my reproductive system all the way up into my esophagus. So my diagnosis through surgery happened when I was 31. I lived with this disease for 22 years without a diagnosis. Um, I decided to get surgery for a few reasons. One was hope just for more information about what was going on. Two, hope to remove and reduce the disease enough to be able to manage it myself. And three was to possibly pave the way to maybe be able to have a baby. Um, so after that first surgery, I created a protocol for myself, created like a full holistic health plan. And there were very few resources. Oh, yeah.
Because I want to speak on behalf of the oh my God coming up in the chat right now.
Yeah.
And all heck is that we're doing the best we can. We're both very rural people, so this is as good as you get on the got
Yeah.
going. But just to pause to say, your first real diagnosis of this that had a confirmation came with a stage 4 out of 4 stages, right? There is no stage 5, a
Correct.
stage 4 diagnosis, and it had gotten up to somehow this process was happening in your swallowing tube. Can you pause a little bit more to say how were they looking as they did this exploratory? What tools were they using? Long was your surgery?
That's a good question. Well, my first surgery was about 6 hours. It was like pretty long and pretty intense, longer than they had maybe thought that it would be.
I wanted to pause you because that's the kind of thing that often happens and we kind of minimize it. But it's really important to think that you went in thinking you were getting a kind of a light diagnosis walkthrough and you came through a pretty significant piece of institutional medical trauma built into the treatment. Continue.
Yeah. Yeah. Um, Yeah, that it was intense receiving that diagnosis, and they speculated that it was up in my esophagus because of where my pain was located also, and because of different symptoms that I was having, and because of the hiatal hernia that I have that's, like, pretty far up in my body. In the second surgery that I got, and I'll get to this, they went further up into my body, and a third surgery was recommended that I declined, and that was yeah, I'll just pause there, but
Yeah.
I, yeah, I created a protocol for myself after this first surgery, and that was empowering to be able to actually have a diagnosis, and to be able to kinda run with that,
As
and
you into this, how was your recovery from the actual medical piece as you moved into your more holistic look at what you were going to do time-wise?
yeah, I had that first surgery in May, and it took me until November to be able to, like, carry heavier things. It took me many months to recover. Um, and then my second surgery was in 2022. The first one was in 2021, and it was 10 months after the first. And I had become much more in tune with my body and this disease during those 10 months. Um, I had really been working on this healing protocol. I was really working hard at trauma therapy and de-escalating my nervous system to really reduce my inflammation.
So I
Um,
pause you to sort those 2 things out for us. As you look at your plan, can you talk about what you did? I know it's holistic, but can you talk about what you did with respect to behaviors and food, and then tell us what you did with your trauma work?
yeah. Yeah, well, I would say it was like a three-pronged approach.
Right.
One, trauma therapy and nervous system de-escalation. Two, supplements that were tailored to my particular symptoms. And three, herbal medicine and mushrooms to reduce the spread of the disease and the inflammation. And within that, more specifically, I focus on supporting the kidneys, the liver, and the stomach. Um, I focus on reducing the spread of the disease, like I said, with mushrooms and herbs. I manage the inflammation and brain fog in some different ways, but that's like a really key piece. I adapt my diet, especially 1 week before menstruation and during. And so I eliminate caffeine, alcohol, red meat, really reduce dairy during that time. For a period of time, I tried a vegan diet, and that was actually just kind of inaccessible to me, and so wasn't that helpful. But
Can
for
I
some, it might
there
be.
well, because
Mhm.
we are a culture of people who have a usually big relationship to our food. You need either fascination either way, over or under. And when you were talking about how you manage this, you don't have to do it all month long. I wanted to emphasize that piece that you'd figured out a way to have sometimes when you
Mhm.
are aware of your cycle, you don't have to be as stoic as you
Mhm.
would be, just eliminate everything
Right.
24/7.
Right. Yeah, and I found that to be helpful enough and manageable enough for me because eliminating all of those things all the time didn't feel accessible to me. It was like yogurt is a huge part of my diet. Like, there are things that I also needed to like work with the realities of my life. Um, I just want to add two things to this protocol that I'm talking about, this healing protocol, and one of those is befriending pain and trying to move through the pain in a different way rather than with aversion, like with breath and actually really leaning into it and uh, not trying to just have it go away, even though that's what I was wanting. And then really creating a support network around these two surgeries. I absolutely needed help. And I really strengthened my community during that time where I finally felt like I was getting close with people because I was depending on them, and people showed up in really beautiful ways, and it taught me how to show up in community care in a very different way, and was a profound that was a profound lesson for me.
Thank you for
Um,
the background noise was the pandemic. Can a little bit to that, and then we'll keep going with your other 2 prongs on this?
yeah, thanks for pointing that out. So, yeah, these surgeries and this diagnosis took place during the pandemic. And in 2022, during my second surgery, we were experiencing a resurgence of high numbers of COVID in hospitals, and all non essential surgeries were canceled. Um, and there was one hospital bed at UVM for all women's reproductive health patients. I'm going to say that again. There was one hospital bed at UVM for all women's reproductive health patients. so so during that, my surgery did get rescheduled, but I got to reschedule it pretty luckily about a month after it was canceled. It was outrageous, Phoebe. And it um the healthcare during this time was atrocious. And also during that time, I don't think I received particularly good care during my second surgery, and I notified the anesthesiologist that I was having some concern about being able to like actually stay unconscious during the surgery, and I ended up waking up during that second surgery, and that's another piece of medical trauma. And it was pretty poor care during that time.
Heard.
So that's like, it's like all of this is like cloaked in that period of time and the isolation of that period of time. And what a time for trauma therapy and trauma healing for all of us during that time. And so it all just, came to light for me in a very particular confluence of factors.
Thank you for sharing so deeply. Now going to your other prongs, particularly from the trauma of the medical system to the trauma that you were digging and exploring and excavating and adventuring into. Do tell us more.
Hmm. Well, you know, something that yeah, I don't know how much more I wanna go into about the medical trauma, but I will
I'm
say that
thinking of the
some yeah,
specifically. I was saying that you had said you were doing some work, you named certain
yeah.
organs, the gut, the liver, that how that came in next or side.
Mhm.
Yeah.
Okay. Yeah, I did wanna name that after that second surgery, my surgeon who had been with me during the first surgery too, she said that she was pretty amazed because she actually found less disease than she was anticipating finding based on my first surgery, and what she said to me right after surgery was, "Whatever you're doing is working. Keep doing what you're doing." And I
Right.
really took that as validation around this protocol and around what I was doing and, like, leaned in harder. And so these other prongs, trauma therapy and nervous system de-escalation, felt so important for me, and I think is an incredibly part of working on living with this disease because the pain in the nervous system, like all of these little endometriomas, like Opeyemi was talking about all of the cells with the tissue from uterine lining that are living outside the womb, they all bleed and they all become inflamed. And so when you have those, they are kind of like little tap roots into your organs and other places. And so when you bleed or when you have inflammation, like everything everything is inflamed. And when you're experiencing trauma, your body is experiencing inflammation. And when you're experiencing the nervous system anxiety and escalation, you're experiencing inflammation. And for me, that all really increases my pain. And so learning different tools and like doing the deep work of unpacking trauma, I have found to be incredibly helpful to have my nervous system at a different baseline. So I cite that as kind of like the number one thing that I feel like is really important. Um, there are some really specific supplements that I use that I have used that I'm not currently using because I'm breastfeeding. But they're tailored to my symptoms.
So I
Um,
want to pause you. You say you're breastfeeding. Endometriosis is the number one cause of infertility in women. Can we asterisk or track just a minute to say you are the mother of a child? You
yeah,
have offspring from your own womb. Is that not true?
it is true. Yes, I have a baby who's sleeping in the next room, and she's such a miracle. And it is no small feat to have had a child from stage 4 endometriosis. And it was not a passive feat. I also, I, uh, yeah, as OPM, you mentioned the rates of infertility are really high in endometriosis, especially in stage 4 endometriosis. And I knew that I wanted to have a baby, and part of my treatment and healing process the whole time was to try to enable that to happen. And in March 2024, without intervention, um, I and I got pregnant, and then I had a healthy baby and an unmedicated birth without intervention in November 2024. So it's really wild. And I did have some complications during pregnancy. Pregnancy can either make endometriosis more or less painful. For me, I felt incredibly fortunate that it was less painful. Some of the complications came in surprising ways, like so many things with endometriosis, where it's like, what is happening? And it's ambiguous and confusing. And I learned while pregnant that endometriosis can skew test results about your pregnancy. And so I got some like pretty typical testing done to test for chromosomal abnormalities and some other things. And those tests came back inconclusive. And I learned that is probably due to having endometriosis. And I don't know exactly why or what that is. But and I also had my baby a month early, and endometriosis is a possible cause for early term births.
And the baby was outside of conventional hospital a month early.
I was planning for a home birth, and I was 6 days shy of being able to do that. My midwives would not do it that early, and so I
Yes.
ended up having to birth at UVM Medical Center.
Thank you.
Yeah.
And how long did you and the baby or the baby together or separate stay before you all got to be home again together?
We did a pretty amazing job getting out of there as quickly as possible. As soon as we got there, I was like, "We're having this baby and we're leaving." And so we were there not even 48 hours,
Hey, yes.
like about 36.
I so appreciate your sharing the details of this because you've really been a warrior woman and a very courageous being, and you have a very quiet presence. But the amount of magic you have manifested, transfested for yourself with respect to offspring and personal care around a chronic illness is to be shared. So thank you very much. And it says this is so very informative and absolutely
Riveting.
thank you.
Thanks, Phoebe.
I'm doing one of my 3 ways of seeing, which is to have my, long and short-term vision, but I have to sometimes adjust where I am rather than pull up reading glasses, okay. So
Mhm.
coming in for a landing in the next 5 minutes or so, what else would you like us to know? We yeah.
Yeah, I wanna one piece that I wanna share that highlight this, is that access to care for endometriosis is an incredible challenge, even with health insurance, which I've had for at least 15 of the 22 years that I've been navigating this. Endometriosis is deeply exacerbated by sexism. There are other compounding factors: race, class, location, health insurance, gender identity being a few that reduce access to care even more. And all people who have endometriosis have a condition that is a manifestation of sexism. And the rhetoric that women are being hysterical, overly emotional, manipulative, and dramatic plays in. Not believing women plays in, stigma around menstruation and female reproductive systems play, and where people won't even say ovaries, or like saying uterus is like a dirty word. The lack of funding for research and development of the disease and treatment plays in. Endometriosis is as widespread and debilitating as it is because of sexism. Um, and so I want to highlight that piece. A lot of what's happening here is preventable. And I believe that there are less invasive ways to diagnose endometriosis, and that symptoms um, are so much more than painful periods, which is what endometriosis is often minimized to. Also, they say that endometriosis is an incurable disease, and I believe that there are ways to cure this, but it really takes attention and focus. And the way that the Western medical system is navigating this is not helpful and is like deeply minimizing to people's experiences. Um,
So
so yeah, I wanted to I wanted to highlight the access and the
yeah.
very, very poor access.
Access in the present moment. What you said about insurance, noted. Noting that none of us may have insurance very soon, I want to remind us that when you looked at what your actual treatments were, once you got the diagnoses, a lot of them were totally outside of the conventional medical model and wouldn't be covered by your insurance or your drug payments anyway. So I also suggest that in addition to getting a diagnosis however we can, at this moment, that's difficult to get. Assume you have the diagnosis and move forward with some of the treatment options. Where should people be looking for treatment options? I want small groups to be getting together and informing each other. There really isn't like a huge amount of data out there in a big library for you to go to right now. There's reliable and less reliable sources. I will put in a little YouTube video over the next week, a show and tell of what I found with the endometriosis ad popping up on the search way ahead of any actual information. And the ad was for one of the drugs that's being recommended right now for this with so many black boxes. It was stunning, starting with cardiovascular issues. So one of the questions was what happens with all of this postmenopausal?
Well, um, a lie that I've heard some false information about endometriosis. One of those things was that endometriosis will resolve itself with menopause. That is not true. I've also heard that a hysterectomy can cure endometriosis. That is false. And so these are not treatment options. We're kind of just like biding our time and waiting for menopause is not the answer. Um, and it is a I don't know of any space where it's like there is holistic care options and information about endometriosis, and it's really a very much a personal journey. But I love your idea of small groups
And when
uh,
I say
sharing together.
3 to 8. I'm being very realistic about what I've seen work as a whole systems person who looks at where you can make interventions that are helpful. So, particularly with this being launched on a platform, look in your local neighborhoods because I really do think a lot of this needs to be back to synchronous conversations with people at least and better boots on the ground and train with other people within 6 feet of each other conversations. We've
Mm,
gotten away from that, and I know there are reasons. But the tending and befriending hormones that we all do when we're around each other, we do it better when we're face to face. We do it a little better than whoever's watching this on a recording when you do it as a live stream and you can interact through a chat box. And here we are coming to a conclusion. So I ask you, what else would you like us to know on a final round?
hmm. I mentioned this just a little bit, but I learned a lot about asking for help. I've learned a lot about asking for help within this, and have been practicing organizing and being part of communities of care as a result of these experiences, and that has been profoundly healing in a lot of ways. And as well as sharing information, sharing some of my story, and continuing to understand how it has shaped and continues to shape me. And all of this is healing.
Thank
So
you so
onward.
and talked about those coincidences, those places. Oh, yes, there was the COVID. I mean, the places where you went deep, and I appreciate your going deep. And I also want to say, I heard miracles in there.
Mm,
I heard places where I'm sorry, but it cannot be explained in rationally deduced linear time. So
right.
I appreciate that you shared some of the miracles and you just let them be mysteries on how all of this happened. And other people can be inspired by your story and your rational part of your story. We are going to be finding the places together where we make a difference. The last piece is I couldn't believe that there is a theory out there now that some of this can be related to a bacteria that is in us. So, to the idea that all of this could be treated with antibiotics in some way, if we look and pay attention, is also a little mind blowing right
Right.
now.
Yeah.
As far as would have been a really nice thing to be working on or knowing about a little bit before now. But for all of us right now, this is what we can work with. Thank you for sharing. And this will be available on as many platforms as I can make it stick. Thank you.
Excellent. Thank you, Opeyemi.